first thing that comes to mind when I think of Dr. Blatt is someone who is a pioneer. So I think of someone who, in some ways through total chance, was in a particular practice at a particular time in history where at the very beginning of an epidemic. And I think not through planning anything, not through thinking that this was going to be how things worked out, I think he was responding to a need within the community that nobody anticipated in a million years was going to happen.
I'm David Blatt. My partner David Moore and I started the practice which became Triad, which eventually joined Howard Brown in 1981. We saw the need for a practice that took care of gay men and women. It really wasn't happening then, and we had the both pleasure and work of trying to help figure out this model that didn't really exist back then. Over the subsequent years, HIV happened. Together we took care of thousands of people.
It was wonderful working with David. Every day was unique. It had its own challenges, but always we had each other for counsel, for support. And I think we've always been best friends. So outside the romance, there was just the ability to always have each other there in the middle of how hard things got.
For me personally, I thought it's amazing to see him work with patients. And a lot of people, it was really hard. When he retired, it was just really, really difficult because people were crying and weeping and patients were weeping in the hallways, and I think he's a tough act to follow.
And one of the great parts I learned, seriously, was doing this. Rather than this, looking at people. If there was something really bad news we were facing, I felt like it was more facing it together. Well, I actually like taking care of people. I started as an orderly in a very busy, funky ER at age 15, and the intimacy that allows the exam room doors closed, or I'm sitting on their bed in the hospital, is really very attractive to me.
David is a true friend. I think that most people who know him, including his patients on some level, get that and understood that they had in David not only a trusted advisor, counselor, and doctor, but a friend.
Many of the patients have lost their partners and remember, Dr. Blatt being there and remember Dr. Blatt responding to that, and really during an era where people didn't really want to touch you and people didn't feel comfortable taking care of the LGBT community, and it was a big, big unknown. And so I think it just takes a particular kind of person to not run away from that and to stay and do the really hard work, which isn't heroic and it isn't high profile. It's really being there in a relationship with a patient and a client through whatever comes down the line. When
I was in training, the notion was you're supposed to fix stuff. You're supposed to cure the person, make it better. Yes, life was finite, although people didn't quite get the hospice concept back then, and people didn't quite get it wasn't going to work situation, even though we are all finite, we're all mortal, and you'd think we'd get. So when I guess the hardest experience I've had as a doc, I think it was making peace, I guess, with how impossible that became in the early years of HIV.
It was a very long time, 12, 13 years before protease inhibitors were developed, and we began to see that there was a way out of the forest, which we'd been in for over a decade. So it was a very difficult decade.
It's the kind of bravery of responding to something that wasn't planned for and responding to the patient's population and patient needs, of the LGBT community at the time.
The group that assembled, both the Masonic here as the hospital and in the community, were amazing. Everybody was passionate about it. People would take patients home, literally. Nurses would take patients home, and the way that they'd really support each other was really touching. So again, not an achievement of mine, but something of which I was a part that I'm really proud of, and was sorry the need was there, but it was, and people really rose to the challenge.
David's 2 years out of his practice now. He's still showing up at hospitals to visit patients that he hear in the hospital, or to go to their family member, to call them on the phone to provide support. He didn't stop the day he walked out the door from his office. And that's what I mean about being a friend, about being a compassionate and caring person. It's an integral part of him. It didn't go with the stethoscope onto the cupboard shelf.
I think the LGBT community utterly and completely trusts him, and I recognizes that he is coming from a place of wanting to be of service. And I think that is an approach that we need to take within clinical care, which is that we're here to be of service.
Well, I thank you all for your generosity about both today and the award. I really appreciate it. It really means a lot to me. It is not deserved by me, but is deserved by the people I represent. And so thank you.
I know how really hard it is for David to accept this kind of an award, this kind of appreciation in a demonstrable way, because he is so selfless. And I would just say, take a deep breath and let it in. You deserve it. You're a lovely, wonderful man. Enjoy this moment, and then go on and keep doing your good work.